Let's talk about the stomach. What kind of symptoms does the stomach produce that makes people afraid or go to the drugstore to use medicines?
Well, there's a couple of terms that we commonly throw about. One is called heartburn, and that is where some of this hydrochloric acid can come back up into the esophagus. And because the esophagus does not have a protective mucus barrier, it causes burning, and you can call this acid reflux, or what we commonly call gastroesophageal reflux.
So that's the GERD.
That's the GERD.
Is that dangerous? Can it do some bad stuff to the esophagus?
It can scar the esophagus, narrowing it, and therefore large bites of food or bread have a sensation of not going down well or hanging up, and occasionally it can occlude or block the esophagus. Also, you can get mucosal changes in the lining of the esophagus. That can be a precancerous condition known as Barrett's esophagus.
And so that's all from reflux disease. How about acid indigestion? Just not reflux, but just bad stuff in the stomach.
So the term dyspepsia really refers to any upper GI or upper abdominal symptom. Typically it's burning. Sometimes it can be abdominal fullness, or what we call early satiety, where you stay full after a meal for a long time. But acid, yes, can do some damage in that there are certain medications like arthritis medicines that can diminish or thin the protective barrier of the stomach and therefore lead to ulceration of the stomach or upper portion of the small intestine.
If I have a heartburn, acid indigestion, gnawing sensation in my stomach, go to the drugstore, I can get antacids, I can get H2 blockers, I can get proton pump inhibitors.
Yeah.
What are the medicines that are available, and are they helpful? Are they dangerous? Talk to me about if I should go to the drugstore or I should go to the doctor.
Well, antacids have been around for a long time, and there's really two basic ones. One that contains calcium, and that is a good source of calcium. But if you're prone to kidney stones, it may not be the best product for you. The other product that neutralizes acid is the magnesium-based antacids, and again, too much can produce diarrhea by drawing water into the colon. So in moderate use, they're relatively safe. The H2 blockers have been around for a long time under the brand names of Tagamet, Pepcid, and Zantac, and typically decrease hydrochloric acid production by about 1/3. And been around for a long time and relatively safe.
So we've got antacids like Malox or Tums for the tummy.
Correct.
And then we've got the H2 blockers, Tagamet, Zantac. How about proton pump inhibitors?
Well, proton pump inhibitors were first introduced around the 1950s, and at the time they were introduced, their use was somewhat limited. We've now been using them for a long time, and they've now been released over the counter. They are very potent reducers of acid by up to 70%. Now that they've been around for about 30 years, we're starting to see some long-term side effects. Short-term, they're relatively safe. Most over-the-counter PPI therapies advise you to limit their use to about 2 weeks before seeking medical advice. What we don't want is people taking these medications assuming they have one condition and it turned out to be something much worse.
What would be an example of that? Somebody had a gnawing sensation in their stomach was bothering them. They took a H2 blocker, Zantac or Tagamet, seemed to help. What could be wrong with them?
Well, certainly we always worry about an upper GI neoplasm, a cancer. We don't see gastric cancer as much. We see some esophageal cancer, and that can produce pain or, again, a sense of food not going down well. And we would not want to mask these symptoms by having somebody take an over-the-counter proton pump inhibitor for a long time without seeking medical evaluation.